My name is Vikas Kapil. I'm a consultant at the Bart's Blood Pressure Centre of Excellence at St Bartholomew's Hospital in London, and I'm going to talk for a few minutes about the importance of dietary modifications in blood pressure and hypertension. So control of blood pressure is one of the most important ways that patients and the general public can control their risk of heart attacks, strokes and kidney failure. And there are two strategies to control blood pressure. One is by the use of medications that will be prescribed by general practitioners and specialists. But the other track is the lifestyle modification that patients can do themselves. This is particularly important because not everyone's aware that they have high blood pressure. And we know that the awareness of blood pressure in the UK is increasing year by year, but it's still not perfect. Now, if you read the mainstream press or magazines, it's very easy to be confused about the advice we're given about what type of dietary patterns we should follow. One day you'll read that having a high-fat and low-carbohydrate diet is correct, and when you read something the next week, you'll hear about antioxidants and superfoods, and that protein is good. There are some clear recommendations to dietary modifications to lower blood pressure and cardiovascular risk that we advise in the UK. One of the most important is the reduction in the amount of salt we consume. And the UK government has been working very hard with the food agencies and the food producers to show that salt labelling on foods is clearer, using the traffic light system so that we know that if we're looking at labels that are red or amber in colour, they have very high salt content. So we should be trying to eat more foods that naturally are of the green traffic light system, which shows that they are low in salt. Another area of dietary modification that's important is the amount of sweetened beverages we have. There's increasing evidence that carbonated fizzy drinks that have added sugar are associated with increasing levels of blood pressure. And those are things that we should try to avoid, but I'd like to spend the rest of my time talking about what things we could do actively and what types of foods we should be eating. And one of the most important things is that it's important to have a varied diet. In particular, having a varied amounts of fruit and vegetables in our diet has been shown to lower blood pressure and is associated with smaller risks of having a heart attack or stroke. Foods that seem to be particularly good at lowering blood pressure and cardiovascular risk are green leafy vegetables, such as salads, spinach, rocket, beetroots that grow with green leaves. And these have been shown in studies to reduce blood pressure and reduce the chance of having heart attacks and strokes. Now, it's not entirely clear at the moment what it is in the vegetables that's beneficial. Vegetables have lots of good things in them, such as fibre, potassium, dietary nitrates. But to some degree, it doesn't really matter what the beneficial component is, as long as we're actually consuming those vegetables in the first place. A varied diet would also include components that come from the Mediterranean diet. We know that countries that border the Mediterranean, which have high fruit and plant-based oil contents compared to animal fats, as well as lots of fresh vegetables and high levels of oily fish, also have lower risks of heart disease and strokes. So combining a high fruit and vegetable diet with possibly having more plant oils, such as olive oil or rapeseed oil, which you can get in the UK very easily, and trying to keep a low saturated fat diet are probably the most prudent ways that we can lower our blood pressure and cardiovascular risk.